so others can live, Michael Bracci.
Here's a disturbing but true statistic. Of the number of people here, every one of us, except Kim with the white flower and these two gentlemen with the red flower, will need a blood donation sometime in their lifetime, but only these two people with the red flowers donate blood. Now this doesn't mean we're bad people, because by and large we're very generous people. We give others less fortunate many things. Some people donate cash, some people donate their knowledge, and others donate goods like food or clothing. But some people donate blood, the most vital donation you can give to another human being. Mr. Contest Master, blood types A, B, A, B, and O. My father has a blood problem. Namely, when giving it, seeing it, thinking about it, smelling it, he faints. However, when I asked him about it recently, he said he didn't have a blood problem, but that his fainting episodes were important life lessons. You see, just before he married my mother, he had to have a blood test, and fainted. Then, just before he began a new job, he had to have another blood test, and fainted again. So his lesson to me was, son, don't get married and don't work. Now my objective today is to get you to think about blood so you'll donate it. And to get you to think about blood, I'm going to tell you what blood is, why it's needed, who needs blood, and how the donation process works. Blood is comprised of three major components: red blood cells, platelets, and plasma. Red blood cells transport oxygen and carbon dioxide in our body. Red blood cells are given to patients who have lost blood because of trauma or surgery. Meet Alice Hines. As a baby, Alice endured seizures, which were the first symptoms of neurofibromatosis, a life-threatening disease that creates tumors in the brain. In kindergarten, Alice was diagnosed with her first brain tumor. By the time Alice was 10 years old, she was being treated for her third tumor. Chemotherapy and radiation treatment helped to destroy her tumors. However, they also destroy her red blood cells and platelets. Alice needs regular blood transfusions to live. Platelets are responsible for clotting and are given to cancer and leukemia patients, recipients of organ and bone marrow transplants, and trauma victims. Plasma is the liquid portion of your blood that holds your red blood cells and platelets. Plasma is given to trauma patients, burn victims, and others fighting serious illness or injury. I'll never forget the time I was specifically asked to donate plasma. Having blood type AB makes it possible for my plasma to be given to patients of any blood type. I don't know who received my plasma that day, but it makes me feel good about donating every time I think about it. Why should you donate? The simple answer is because it's needed. The fact is, there is no substitute for human blood. In the U.S., a patient needs blood every 2 seconds, and only 8% of eligible donors in the U.S. donate blood. As our population ages, demand for red blood cells continues to increase, while the supply continues to decrease, in part because younger people don't donate as frequently. And demand for platelets, which only last for 5 days, continues to increase as chemotherapy treatment for cancer patients becomes more common. Who needs blood? We all will. It turns out that 97% of us will need at least one blood transfusion sometime in our lifetime. Quick story about my grandfather. whose name was Anthony Rebholz. I called him Papa. When Papa was 55 years old, he underwent a surgery that he didn't expect to wake up from, but did. That surgery required blood from 10 donors. Those 10 donors helped save Papa's life that day, and because he survived, he lived on to become a vital role model for me and provide much needed support and stability to my brother, sister, mother, and father. So not only does a blood donation help save one patient's life, but that patient lives on to help save others. How does the donation process work? Donating blood is extremely safe, highly structured, and quick. There's 4 steps. First, your medical history will be taken to make sure you're eligible to donate. Next, you'll undergo a brief physical exam to make sure you're healthy enough to donate and don't faint while donating. Your blood pressure, temperature, iron level, and pulse will be checked. Next is the donation itself, where all collection material are sterile, used once just for you, and then thrown away. If you're donating blood, it'll take about 10 to 15 minutes. A platelet or plasma donation will take about 100 minutes, about the time it takes to watch a movie. While donating platelets or plasma, you'll be reclined in a comfortable easy chair, watching a movie of your choice, doted on with drinks, and enveloped in warm blankets. After your donation is complete, you'll be treated to some snacks. Now you know what blood is, why it's needed, who needs blood, and how the donation process works. Blood is needed by patients who have lost blood because of trauma or surgery, and others fighting serious illness. Donating blood is extremely safe. Donating blood will make you feel good about helping others. If you can't donate, please encourage others in your family to do so. Donating blood is the most vital donation you can give to another human being. Please give so others can live. Mr. Contest Master.